My name is Eileen Espiritu. I am the Benefits Manager for Essity North America, Inc. We have approximately 220 employees here in the Philadelphia area, but nationally and across the country, we have about 3,300 employees. Essity is a health and hygiene company. We produce and provide services, anything from compression care, wound care, also to feminine care, baby care, and paper products. So the brand slogan for our company is actually breaking barriers to well-being. I think the reason why we are a member, we like to partner with other organizations that embody our beliefs and behaviors. The first is making sure that we have courage to make change, courage to break barriers. And the coalition itself has just a wonderful amount of courage to make sure that our voice as employers are heard. We want to be committed. We want to show our commitment to our employees and their families, and the coalition shows a great amount of commitment to its members through the various services and programs that they provide to its membership. We want to care about our employees, care about their families and the membership. And the coalition truly cares about the employer groups that are part of the coalition, including our affiliate members. It's just a wonderful network of people who care about the health of the members throughout the region and across the country. And finally, the reason why Essity is a member of the GPBCH is to collaborate. This is a wonderful opportunity for members to network, to learn from each other, to share best practices, to share lessons learned. My membership in the coalition benefits me in several different ways. Again, being able to network with my peers, that's just a wonderful opportunity to learn from them, to share with them, to understand perhaps if we're having the same issue and working together to help resolve it. It is a way for me to gain access to benchmark data. Part of how I see our benefits program at Essity, it's a way to attract and retain talent. And I need that benchmarking data to make sure that we're being competitive, that we're keeping up with our peers, and in some cases, perhaps you want to be trailblazers with what we offer in our benefits program. It benefits me, it helps me stay up to date, particularly on issues in the benefit space, in the healthcare space, but also in terms of compliance issues, making sure I'm up to date with the law and how the law is impacting healthcare benefit plans. So it's just a wonderful resource of making sure that I'm keeping up to date and I'm being good at my job. I participate in the benefit design interest group. It is a wonderful way. Again, I see our benefits program as a tool to attract and retain talent. It is also a part of an employee's total reward package. So it's not just about their pay. We offer them very competitive and comprehensive benefits. So I like the participant group. It just keeps me up to date, making me sure I think about how we're designing our benefits program. Does it make sense? Does it provide value to the employee? Or does it prohibit them, or does it put a barrier in them for them to get care? I think we need to really, when we're looking at our benefits program, we need to be intentional. We need to remember, what is the purpose? And as a company, we want to break down barriers to well-being, and I have to think about the benefits program through that lens. So the interest group that I participate in is very helpful, again, to making sure that I am looking at our benefits program holistically, and at the end of the day, that I'm providing value and I'm enabling people to get the care that they need. Being engaged in these initiatives brings value to my employees in several different ways. The coalition gives me the opportunity to collaborate with my peers and to help me, one, increase health literacy, and number two, making sure that our employees are engaged and understand how to utilize their benefits to keep themselves healthy, to keep themselves and their families happy and secure. So a number of different ways I participate in the coalition's in-person or virtual programs on certain topics. I attend the annual conference. I attend the Wellness Summit, which is another wonderful opportunity to really think about what can we do to help our employees take care of themselves, to improve their well-being, whether that be their physical, their mental, or their financial well-being. So it's just a wonderful resource for my employees to benefit from, for their family members to benefit from. The coalition also, helps us to understand what other vendors are out there that might benefit after we look at our healthcare programs and where our spend is going and really analyzing our data. There might be good partners that we can have that, yes, they might lower costs, but at the end of the day, they provide the right care to our membership at the right time. And truly, it is all about making sure our employees stay healthy and stay safe and feel good about themselves. I also wanted to highlight that there are group purchasing programs that are available through the coalition, and I'm proud to say that Essity takes advantage of one of the programs that the coalition offers, which is pharmacy benefit management services through their close collaboration with Employers Health. And what we as a company at Essity, we truly value that program. It has saved us, I can say, millions of dollars in our pharmacy spend. And how this program helps us is a myriad of different ways. But one, through that partnership, our contract for pharmacy benefit services is actually marketed every year to make sure that we're getting up-to-date contract terms, pricing, and discounts and rebates. They offer us really detailed reporting that you can't get typically on your own. I have the market power of the entire membership of the coalition to make sure that we're getting that great pricing. If I had to do it on my own, or our company on our own, we would never get to that level. We get dedicated service team who helps us with any issues. We have dedicated reporting team to help us with the reporting. It's also have the clinical background of their own pharmacists at Employers Health to help us make sure that we're actually putting in place programs that are beneficial, one, for the membership, making sure they're getting the right medication, the right time at the right price, and that it's safe and that it's effective. And number two, hopefully it also makes sure that we are managing our drug spend. For a lot of employers like Essity, specialty drug spend is a cause of great concern, and we see that the utilization of these drugs increases year over year. The spend for these drugs increases year over year, and typically the utilization of those drugs is a small percentage of our membership, but even that membership that's utilizing it is also growing. That is the trajectory of prescription drug spend, and we need a partner who's going to help us manage that spend, making sure it's appropriate, and putting in place programs and tools, not just for the employer to save money, but for the employee or the family member who's utilizing that drug to get the care that they need. So through that program, through Employers Health and GPBCH, it has just been an amazing experience. We also get our rebates through this program in a much more timely manner. So there are a lot of advantages to the group purchasing program through the coalition.